sCD14-ST, a soluble subtype of CD14, is a glycoprotein fragment derived from monocytes and macrophages. It is a biomarker indicating the activation of innate immune cell response to an invading pathogen. As a result of such response, CD14 will be expressed on the surface of various immune cells. CD14 binds to the LPS-LPD complex and activates TLR4. Then, it initiates innate immune response to infectious agents. sCD14 is cleaved by cathepsin D and other proteases. The N-terminal fragments of CD14 are released. Compared to PCT induced by cytokines after bacterial phagocytosis, sCD14-ST is a more direct infectious biomarker, which is mediated by pathogens. Pathological studies and clinical trials have revealed that sCD14-ST is important for the clinical management of infectious diseases or related conditions, such as neonatal sepsis, prosthetic joint infection, PJI, febrile neutropenia, FN, sepsis, and early infection in trauma. sCD14-ST plays an important role in the rapid assessment and evaluation of severity of neonate sepsis. Neonates with sepsis have significantly higher sCD14-ST levels than those with non-infective SIRS and normal control groups. This suggests that it could be an indicator for identifying neonatal sepsis, SIRS, and normal control group. According to some researches, sCD14-ST levels were significantly higher in neonates with sepsis and sepsis shock. During the first 48 hours from onset of symptoms, its level increased progressively in neonates with sepsis shock, while it remained stable or decreased in patients with other conditions. sCD14-ST is also a potential inflammation biomarker for the diagnosis and prognosis of PJI. Research has shown that sCD14-ST levels were significantly higher in PJI patients than in normal control groups. The sCD14-ST levels dropped significantly in PJI patients after a long period of post-operative recovery and remained unchanged and were significantly lower in non-infected patients. Moreover, sCD14-ST is an early diagnostic marker of febrile neutropenia in patients with hematologic malignancy. According to a relevant case study, elevated levels of it were observed 1 day prior to CRP. Further, close monitoring of sCD14-ST levels can prevent infection-associated deaths of patients with hematologic malignancy. sCD14-ST is also a reliable biomarker for bacterial infection. Its levels in patients with bacterial infection were higher than those with other conditions. In terms of adult sepsis, sCD14-ST is a predictive marker since its level increased significantly in patients with sepsis and septic shock. sCD14-ST levels can also be used to identify severe and critical sepsis, which is critical for the clinical management of ICU patients with sepsis. Besides, sCD14-ST is a powerful monitoring tool for the treatment of sepsis. For early differentiation of infection in trauma patients, sCD14-ST is specified and effective. Infection is common in people of all ages and around the globe. However, the signs of infection are not always noticeable, and to differentiate them accurately can be a challenge. As mentioned above, sCD14-ST has proved to be sensitive and accurate for the detection of infection. To better meet the needs of our customers, Mindray has now incorporated IL-6, PCT, and sCD14-ST into the inflammation solution for clinical application and management.